Okay, folks, I have 2 o'clock on my clock. We seem to have a full list. Dr. Roussin, I will turn the floor over to you. I'll remind all the media outlets that when we conclude this, I will call upon you and we'll go with one question, one follow-up, and it looks like we'll probably have time for a floor of a scrum series afterwards. Dr. Roussin, over to you, sir.
Yeah, thanks, Glenn. Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today, we are moving forward with the next phase of our fall COVID-19 vaccine campaign. Starting tomorrow, anyone 18 years of age or older will be eligible to receive the bivalent COVID-19 vaccine. This means you can call or go online to make an appointment. You can get your vaccine from locations across the province that have it in stock, such as pharmacies and medical clinics. I want to discuss why public health is strongly recommending this fall booster and to receive the bivalent as your booster as soon as you become eligible. First, we have to remember that our immunity to COVID-19 does wane over time. So if you've had your previous doses or even become infected in the past, your immunity does wane over time. And this booster is a great way to recharge that immunity, to boost that immunity once again. So if it's been a minimum of 3 months since your last dose, you can now get this bivalent booster. We know from the evidence that if you wait a bit longer, that 6 months duration between your last dose and the booster, you even get a stronger immune response. So public health does recommend the 6 months interval, although there is just that minimum of 3 months for anyone since your last dose. So the bivalent vaccine is the vaccine that we are recommending strongly as the vaccine you receive for your booster dose if you're 18 plus this fall. We know that the original doses, the vaccines that we all received, were monovalent, or a single strain of that vaccine. The bivalent vaccine obviously has 2 strains, the original strain, the ancestral strain, and the Omicron strain. And so we know from the evidence that this provides the broadest protection available at this point. So not only does it protect against those 2 specific strains, but it adds additional protection against all of the variants that we've seen over time. So that's why it's important to get that booster and to get this bivalent vaccine as that booster. The bivalent nature of this, those who get the flu vaccine would be familiar with this. The flu vaccine has typically had 3 or 4 strains in it to provide that broader protection. And so we certainly use these multivalent strains, multivalent vaccines in the past. And we know that this has shown to provide great broad protection against many strains of or variants of COVID-19. If for whatever reason you're not able to receive the bivalent, the original COVID vaccines continue to be available for your booster dose. But again, we do suggest 18 plus that you get this bivalent vaccine as your booster dose. Certainly, if you have questions, do ask your healthcare provider. Great resource for all of these answers. So we know that COVID is going to continue to circulate. And again, so this best protection to you is to ensure you're up to date with these booster doses and to receive this bivalent dose as soon as you become eligible. And that's certainly good advice for you and anyone in your family who's eligible. So there's still vaccines available for children aged 6 months to 4 years and children aged 5 to 17. Age 5 to 17 are eligible for the booster dose, and that would be with the original vaccine. So just to conclude, we know now 18 and over are eligible for newly the new bivalent vaccine and can start booking those appointments tomorrow, 9 a.m., using the online booking tool or through the vaccine call center. You can also contact a nearby medical clinic or pharmacy and use that online vaccine finder map to help you find ones where the bivalent is available. Later this week, I'll officially launch the bivalent vaccine campaign for all adults with a immunization photo op for media. More details will be coming on that later. So thanks, and happy to move to some questions.
Thank you, Dr. Roussin. We'll start today from the Winnipeg Free Press. Katie.
Good afternoon, Dr. Roussin. With the expansion of eligibility for the bivalent vaccine, I'm wondering if you can tell us more about the overall uptake that Manitoba is seeing for fourth doses, including the monovalent and the available bivalent vaccine doses at this point. Is the uptake of fourth doses where you'd like it to be now? Are enough people getting the booster? Can you tell us more about what the situation's like?
Yeah, so it's a little bit early, and then there's a little bit of a delay in how this gets entered into our reporting system. So certainly we're not seeing the uptake that we would want right now. And this is fairly similar, in multiple jurisdictions. So we want to continue to get that message out that, especially if you're at high risk, we want you to get that booster as soon as you become eligible. But right now we're moving that eligibility 18 plus. And we'll continue to report on the uptake over time, but there is that data entry lag where people are booking appointments, receiving a vaccine that needs to be entered into our system and then reported. So at this point what we're seeing is not the type of uptake we're hoping for, but it's really early in our campaign.
Do you have any numbers on that uptake?
We don't have any. I don't have a specific number to report here. We're going to report them regularly, but like I say, it's because it's early on, because there's that lag of getting it into those doses into the system. The number is not all that reliable right at this point.
Okay. What are your recommendations now for people who've been recently infected with the virus? How long should they be waiting before receiving the bivalent vaccine? And just can you explain the benefits of getting boosted even if you've had a recent infection?
Right. Yeah. So the timing. We are requiring people to be at least fully recovered from their infection, but would still suggest that minimum of 3 months. Since being infected to get the shot, but at the earliest it would be just fully recovered. And again, what we've seen is that we know vaccines provide great protection, especially against severe outcomes. We know that hybrid immunity, being vaccinated and recovered from a natural infection, provides even also great protection. So even if you've had an infection, we still recommend getting those booster doses as soon as you become eligible.
A reminder to reporters, 1 question, 1 follow-up is our format. We'll come back for more questions if there's time. Moving now to the Brandon Sun, Karen.
Good afternoon. I just was going through some old notes, and I recall this bivalent covers the original plus the BA1, but I'm just taking around the globe, especially US, they have vaccines that are approved for the BA4 and BA5, which are now the more dominant of all the strains. Is there a reason why that you went with Moderna's bivalent vaccine when it's covering two strains that appear to have waned?
Right. So it's important to note that through the evidence and trials of this vaccine, the one we're using, ancestral and BA1, does provide protection against BA4 and 5. So we do see that it is providing protection, a much broader protection against many variants. And so this was the vaccine that was first approved in Canada. We're still waiting on approval for those other vaccines. but we know this one from human evidence that this does provide protection against those variants that are circulating now.
Okay, thank you for that. And for my follow-up, just asking, you've already got the book online and go to pharmacies and doctors' offices. Will we see any kind of like mass vaccinations or super sites into the future?
Well, there's still ability to book at public health locations. So online, you'll be able to see those locations, and if it suits you to be vaccinated there. Health regions will still be moving with pop-up clinics and things to ensure access to these vaccines. So we certainly have been able to greatly expand our capacity to deliver vaccines because of the help of our partners in medical clinics and pharmacies, but public health is still administering vaccines as well.
Moving now to CJOB, Skylar.
Hey, Dr. Roussin. Yeah, given that low uptake of the 4th doses so far, just wondering what your thoughts are on why more Manitobans aren't stepping up. Obviously, it's not something we're just seeing here in the province, but wondering what you and your colleagues think could be done to address that.
Yeah, and so I think that we're definitely at a different stage in the pandemic than we were at other spots. There's a lot of immunity out there. There's been a lot of vaccine uptake already, and we don't have vaccine mandates really any longer. So I think all that can play a role in some of this. We want to be clear is that COVID is still with us. We're moving into a respiratory virus season where COVID isn't going to be the only virus that's going to be affecting us. And these vaccines are still the best way to protect ourselves from especially the severe outcomes. So as soon as you become eligible for those, your booster dose, we strongly recommend getting that, ahead of what's likely to be a significant respiratory virus season.
Now, for children aged 5 to 17, they are eligible for a booster, but it's not the bivalent one. I know some parents are concerned about going back to school and all of that kind of stuff. And earlier in the vaccination campaign, when we just first heard about the bivalent vaccine, some folks were considering waiting until the bivalent one became available to them instead of going out to get the monovalent one, which might have been available right away. Is that something you would consider suggesting to Manitoba parents as well, or does it look like that eligibility for some of our youngest Manitobans might be a little ways off yet?
Yeah, so at this point, it's the approval status of the vaccine is 18 plus. So NACI and Public Health has suggested that everyone get that fall booster dose. So I would suggest you if you're eligible for the bivalent 18 plus, then use that as your booster. But under 18, I would not suggest waiting. As soon as you become eligible for that booster dose, then I would obtain the one that's available to you.
And now to CBC Manitoba, Ian.
Good afternoon. Good afternoon, Dr. Roussin. Wondering if you can just speak about dosage supply. How many of these bivalent vaccines do we have? How many are we going to get? Do we have enough supply?
Yeah, so certainly we have, based on the uptake and the scheduled receipts, which I don't have a list of the details of all the acquisitions we've received. We're confident that we'll be able to provide a vaccine, a booster dose, a bivalent dose to any Manitoban who wants one.
Okay. A few weeks ago, your deputy chief had told Manitobans that it is okay to get infected. Is that a statement you agree with? Is it indeed okay to get infected?
So I think I think that was taken out of context. If we look at it, sort of what I was saying earlier, we're in a much different place in the pandemic than we have been the last 2 years, right? We have a lot of immunity out there, a lot of vaccine, a lot of natural immunity, a lot of combined hybrid immunity. And then we're dealing with much different variants than we were at that stage in the pandemic. So, taking it into context, it's really, is there some transmission which will occur, for instance, in exchange for allowing our children to be back in school? So these are the ways to, to think about things. So, put it into context. We're much different place in the pandemic. We certainly want people to be as protected as they can, those that are high risk to take additional steps. But we know the importance of things like having our kids back in school.
And we do have a few minutes left. Are there any other questions? We'll throw the floor open. Please introduce yourself and ask your questions, please.
Ian Frey, CBC. Do you think a statement like that, though, minimizes the harm in getting infected?
Well, it's certainly not the intent of that statement, right? And that's why I say I think in the if you take all the comments in that were made, we're not looking at anything that's minimizing, anything. If you take it out of context, then it sure could come across that way, which is certainly not the intent. So I think that we're at a different stage here now, where COVID and other respiratory viruses will continue to be very important. This bivalent vaccine, this booster dose campaign is very important, but we also know it's very important that we also consider the other aspects of health that were put on hold during the pandemic, and most notably having our kids back in school.
Karen McKinley with the Brandon Sun. Just going back, you had said that you were foreseeing a significant respiratory virus season this coming fall. What indicators are you seeing that would lead you to make a statement like that?
I think it's really that every respiratory virus season is quite significant. We see that historically, the respiratory virus season puts increased demands on the healthcare system. And we know that the healthcare system is already under significant strain. And so this upcoming season will very likely increase that strain, as we see in almost all respiratory virus seasons. So that's why we're really trying to get that message out. Get this bivalent vaccine as soon as you become eligible. The flu vaccine campaign will be starting shortly, and we'll need people to roll up their sleeves for that as well.
Just to follow up to, it's Skylar from CGOB. Just to follow up to Ian's question about the supply. Some folks I've spoken to in the last week or so said they called their pharmacy, but they didn't have anything available. So they were looking to book an appointment, but haven't yet. Can you speak to, how many pharmacies across the province will have shots and how many they might have? Should it be quite bountiful across Manitoba in the next couple of weeks?
So I don't have specifics on that. Certainly the vaccine finder will help with that. But, we have a lot of great partners in it, and we expect to have vaccines widely available to Manitobans in the upcoming weeks.
Katie May at the Free Press. Just wondering if you can give any sort of sense of how Manitoba's vaccine programs will change as new vaccines emerge to target different variants, particularly considering the lower uptake that we've seen so far in fourth dose boosters, and how important you said that this bivalent campaign will be. How is the provincial vaccine rollout going to change in response to the emerging needs?
Well, it's hard to predict what change will come. We adapt based on what we see, based on uptake, based on on the epidemiology that we would be observing. So what's important is that messaging, is that we have it distributed widely, that we pay attention to the access, culturally appropriate access to this. So it's tough to predict how things will change, but we want to be focusing on ensuring that there's very few barriers to access to these the vaccines for those who want them.
Ian Frey, CBC, do you have a sense of where we are at in terms of COVID infections and severe illnesses at this point? Obviously, I know there's greater concern once we get into the winter months, but at this point, what are your numbers telling you?
So at this point, we haven't seen much of a change in the levels of severity over the last number of weeks. We see with wastewater data, some areas up, some areas down, some areas unchanged. We do see fluctuations in the amount of say hospitalizations that are testing positive with COVID, but we know when we looked in the past that only a small proportion of those are actually there because of COVID. Many are there incidentally. So we're not seeing a dramatic increase right now in the severe outcomes, but it's certainly something we'll need to watch and watch that for all respiratory viruses.
Do you have modeling for the fall and winter?
Well, we have modeling for the relative near future, showing relatively flat in all things of related to severe outcomes. And certainly that could change over time as we get more into winter season.
Could you speak to what's happening in terms of the monkeypox effort? I believe there is still only one case in the province.
That's right. We haven't had another reported case at this point. The vaccine uptake, has seemed to level off in that regard. We're still providing a vaccine, still ability for people to get that dose, but in most jurisdictions in Canada, we've seen a leveling off of the transmission, and in our province, we still have the one reported case.
Okay, time for just the last couple of questions before we wrap things up. Last call.
Oh, and I'll also ask, because 3 months is sort of the minimum amount for when you should get your next dose. For best immune response, it's 6 months. Do you have a particular recommendation within that period of time? Like, should you wait 6 months? Obviously, people can make their own choices, but do you have a specific recommendation?
Yeah, right. So for the most part, public health is saying is going with NACI's overall recommendation of 6 months. But we certainly wanted to ensure that again, barriers. So people who are really interested in getting vaccines, we're really interested in providing those vaccines. So the minimum of 3 months is available.
Okay, thank you, everyone. Thank you, Dr. Roussin, for your time. This will conclude our briefing on COVID-19.
Thanks, everyone.